Hello, my name is Braden Kralt, and today I'd like to discuss stakeholder perspectives on a London model to reduce discharge to no fixed address. I'm a medical student in the Forchuk research group, and today I'm happy to present some findings on an intervention designed to reduce discharge into homelessness. Homelessness is a growing concern in Canada. Individuals experiencing homelessness have more frequent hospitalizations and worse health outcomes relative to house individuals. When we think of discharge from the hospital into homelessness, particularly from psych wards, it isn't difficult to recognize that those discharged into homelessness face environments that are inconducive to recovery, and this leads to frequent readmission rates. Appropriately, this has been referred to as a revolving door of hospital to homelessness. This research studies an intervention that was implemented in London designed to break this revolving door cycle. So how does the program work? Briefly, patients who are at risk of being discharged into homelessness are identified while in the hospital and referred to the research program by a social worker. Then, these patients are connected with coordinated access to housing services who provide an intake meeting with the patients and provide homeless prevention supports as soon as possible. Finally, eligible patients who are paper ready and have IDs are added to housing priority lists and matched to find housing, housing allowances, and community supports based on their eligibility. This is a collaborative intervention, and access to housing and community supports would not be possible without the help of our community partners, including the Salvation Army, the Canadian Mental Health Association, the London and Middlesex Children's Aid Society, Youth Opportunities Unlimited, and Western Area Youth Services. As part of this research, we also conduct focus groups with community stakeholders to assess what the program does exceptionally well as to find ways in which this program could be improved. So far, based on 3 focus groups, identified strengths fall into 3 main categories. Firstly, this program allows for improved communication between agencies to ultimately provide improved care for patients. Secondly, this program engages with lots of community partners using all services that are available. With this, stakeholders identify that a key strength is collaboration between many different agencies with diverse experiences to provide plenty of resources to affected clients. Thirdly, stakeholders also have praised the coordination of this program. For example, having a single first point of contact to network between participating agencies to streamline access to housing. Now, one of the main reasons we conduct these focus groups are to identify where the intervention can be improved and then strive to make those changes. What could be improved? Well, stakeholders noted that clients can be referred to housing, but only when housing is available, and recommended establishing positive relationships with supportive landlords to increase access to housing for these individuals. For some landlords, there's a perception of extra risk when taking on one of our clients as a tenant, and positive relationships with landlords would help to abate this concern. One other limitation that stakeholders had mentioned relates to improving access to government IDs by collaboration with local community partners. Currently, individuals must have IDs to access the intervention, so streamlining access to identifications would allow quicker access to housing and therefore less time spent in hospital. Lastly, the COVID-19 pandemic has necessitated that intake meetings with coordinated access be conducted virtually. It was recommended by several stakeholders that being physically present is crucial for fostering trusting relationships with clients. We are hopeful that in the near future, as we can proceed more with in-person intake meetings, that this will help foster a positive relationship of trust with our clients. Despite some limitations, which we hope to address as we continue with this research project, this intervention has been an enormous success. I'd like to end today's presentation with 2 quotes from our focus groups, which I feel are a great summary of the value of this program. What's gone well is actually the amount of people that have been supported into housing through our diversion and prevention efforts. Secondly, homelessness is a crisis, but is further exacerbated when it's in a medical setting. I'm very happy that these supports are available to Londoners. With that, I'd like to thank you for your attention, and I'm happy to address any questions that you may have. Thank you very much.